Okay, hi, I'm Jenna Sweeney. I'm in the Psychology 150 class. It would have been on Thursdays at 5:30. So I did my research paper over neuropsychology, specifically clinical neuropsychology. So neuropsychology is the study of the brain and injuries and illnesses of the brain and how that affects cognitive functioning. So there are two types of neuropsychology. There is clinical and there's cognitive. Clinical neuropsychology would be meeting with a doctor in an individualized setting, so this would be in a hospital, private practice, etc. Cognitive neuropsychology would be conducting research of illnesses and injuries of the brain and cognitive functionings, so it would be conducting research of that, and this would mainly be in a laboratory setting. So to become a neuropsychologist, it requires that you major in psychology and then minor in something like biology. That way you can pursue your doctorate and be able to become a licensed clinical neuropsychologist. So clinical neuropsychologists typically see people who have had Alzheimer's disease, Parkinson's disease, or who have had strokes, etc. This way they can accurately assess them and be able to diagnose them. Sometimes other doctors can't figure out what it is that their patient has, so they usually send them to a neuropsychologist to get CT scans done, and that way they are able to correctly treat them. The skills required for neuropsychology include being able to use assessment techniques. You have to understand professional issues and ethics. You have to have culturally competent approaches in neuropsychology, and you also have to understand implications of neuropsychological conditions for behavior and adjustment. Competence in neuropsychology requires the ability to integrate neuropsychological findings with an appreciation of social, cultural, and ethical issues. So all of this is under the skills for neuropsychologists. I looked it up on Glassdoor, which is kind of like Indeed or a job site, and these were the skills that were required. They also had the benefits listed, which included dental, life insurance, health insurance, medical. So if you only have a bachelor's degree and you decided not to pursue your doctorate, this would mean if you had, like, for instance, a degree in psychology and a minor in biology, you would be able to get a job out of school as a psychometrist, a science technician, a laboratory technician, even a psychiatric technician, or a pharmaceutical technician. So this would be if you don't want to pursue your doctorate and you don't want to go to med school, which is completely understandable. The only fallback, however, is it is entry-level salary, so you'd be making half of what, like, an actual neuropsychologist would be making. So if you went to medical school, you'd be able to make double of what you would if you didn't. I couldn't find any opportunities for advancement. I think they're mainly social, so word of mouth gets around. Someone may tell their friend who recently had a stroke, like, hey, I went to see a neuropsychologist, I recommend this person or that person, or I recommend to go here and not here. Whoever is more trustable is likely to get more clients. That's kind of how you build your clientele, I'm assuming. I could not find much information on that, but that's just what I'm thinking. So in conclusion, I think that for me personally, I am going to pursue psychology as my major, and then do biology as my minor, because I'm still unsure about if I want to do something with pharmaceutical or psychiatry, or if I want to do neuropsychology. Those are my three main decisions right now. I have not yet for sure decided, so that is